Hello? Yes, students, am I audible? Hello? Not able to. Just a second. I need to. Am I audible, guys? All right. Okay, yes. Good evening, everybody. So, welcome back to the session. Good evening, Lali, Aisha, Ronak, Jay, everybody. So today we have another session of fast revision of community medicine for FMG students. Although not NEET students, all those preparing for NEET also are welcome to join in. This is the second session. For all those who don't know me, I am Dr. Neha, your mentor and guide for PSM on Unacademy platform. And these are the various places where you can find me. For my Unacademy lectures, you can click on this link. For any additional discount on Unacademy that you want, you can refer to this link. And just a little brief about Unacademy. This December, we are also launching. I hope this FMG is the last December for all of you, when you have to give FMG and you don't have to sit again. You clear FMG in this particular December only. So we've also started a December FMG batch course, okay, for preparation for December FMG, where you can subscribe to Unacademy. You can use my code either PSM10 for a 10% off, or also you can use Dr. Neha 10 for a 10% off, okay. We are also having an intensive revision batch course for NEET PG 2021. I will be taking PSM there. This is starting from 21st of November. Again, you can use my code Dr. Neha 10 and or PSM 10 and get a 10% off. We are running these Target FMG batch courses and also Operation NEET PG, where with just one subscription, you get an access to all the 19 educators who teach you live on the platform. Yes, so just a little bit about Plus subscription. It's Plus subscription. Taking Plus subscription is your access to the best that Unacademy has to offer you. You get an access to daily live quiz classes, live tests and quizzes, structured courses, also unlimited access to all the live and guys recorded lectures to watch from the comfort of your own device. Screen was blurred. Now is it okay? All right. After that, we also have an iconic subscription. In the iconic subscription, we are offering you both the best of Unacademy and the best of Prep Ladder together. So you can access it to get live classes and batch courses, live tests and quizzes, video lectures and Question Bank 2.0, and also other rapid revision courses. Here is just a lookout that those who are preparing for Unacademy NEET PG 2022, we have a daily T20 quiz which is happening every day at 9 p.m. So you can attend the test live. And also we have another Unacademy NEET PG daily 20 T20 quiz for NEET PG 2021, which you can attend the test live at 8 p.m. I take free live classes on Unacademy usually on Tuesday, Wednesday, Thursdays, Friday, 9 to 10 a.m. This is just download the Unacademy app, enter the link, use my code Dr. Neha 10 and get a 10% off. Here we are talking about the iconic subscription where we are offering you both both Prep Ladder and Unacademy at one go. All right, so are you all ready? Just one last point. If you want to subscribe, just it's the best platform for online teaching, for teaching a NEET PG. You get an access to all 19 educators. So do subscribe, use my code Dr. Neha 10 and also PSM 10 and get a 10% off. So are you all ready for the quizathon today? So today I have some questions from previous FMG also, and some of the new expected questions that could come for your examination. So the first question is, all of the following are true about Village Health Guide. All of the following are true about Village Health Guide, except one Village Health Guide is appointed or is based for per 1,000 population, training at PHC for 1 month, formal education up to 6 standard, and responsible for providing health education? So come on, start putting your answers, guys. All of the following, I can see a lot of answers have come in. Someone is writing, John is writing option C. Neha is writing C, Jay is writing B. Okay, so I see that most of you are confused between option B as well as option C. Okay, some are writing option A as well. Okay, so let us study. Now, who is a village health guide? Village health guide is basically a grassroots level worker. Okay, the first important point, grassroots level worker. Now, the proposed norm and the existing norm is the same, one village health guide per 1,000 population. Formal education, the village health guide receives up to 6th standard, responsible for providing health education. So, which is not true? Training at PHC for 1 month. Okay, what is the duration of training? Anybody? Duration of training of village health guide is 4 months. Okay, look over here, I have made a duration of training of village health guide is 3 months. Okay, everybody look at this chart. I have given you a small presentation of the various grassroots level workers that you should know. The first one is Asha is based at village level. Population norm existing is 1 per 1,000. Education up to 10th class, and training she receives is for 23 days. I saw some of you students wrote a training of 23 days. So Asha receives training up to 23 days. Who is multi-purpose worker, male or female? They are based at sub-centers. They are also grassroots level workers. 1 per 5,000 is the population norm. Education is up to 12th class and 12-month training, because they have to solely run a health center. Village health guide देखो 1 per 1,000 population. The education is up to 6 months and the training 6th class, and the training is up to 3 months. All right. Then we have a trained birth attendant. Location is village again. 1 per 1,000 is the population norm. A trained birth attendant need any education. Okay, we just have to provide her a training of 1 month. And lastly is an Anganwadi worker, placed at population norm is 1 per 400 to 800 in plains and 1 per 300 to 800 in hilly areas. Okay, education is up to 10th class and she requires a 4-month training. So this is one of the most important slides of the day that you should keep in mind. TBA is trained birth attendant J. Is it all right? We don't use the term DIES anymore. The word used is trained birth attendant. Okay, so all you have to remember is TBA need not be receive any education but the training of 1 month. Understood everybody? Give me a thumbs up if you've understood. Let's go to the next MCQ for the day. Okay, the next MCQ is yes. What is this logo symbolizing? Is it RMNCH plus A? Is it child's right? Is it family planning? Is it national health mission? So come on, start putting your answers. What is this symbol? What does this logo symbolize? Is it RMNCH plus A, or is it what you call it, child's right, family planning, or national health mission? Good. So I can see a lot of answers coming in. Absolutely correct. This is the logo of family planning. So I've brought a picture for all of you. Look over here. This is the new logo for family planning. Okay, how will you remember it? You will remember it by an inverted triangle. Okay, so this is the new logo. You can remember it by an inverted triangle. Very good, Jay. Inverted triangle symbolizes family planning. Okay, all right. Let's go to the next question for the day. This is from your previous year FMG purely. Okay, what is general fertility rate? General fertility rate, is it an indicator of complete family size? Is it a measure of fertility? It is not better than crude birth rate. All of the above. So this is exactly picked up from your previous FMG. Tell me, what is general fertility rate? I can see some of the answers coming in. Okay, Aisha has written C, Sanjeev has written A. Come on, put more answers. John has also written A. Okay, now guys, what is general fertility rate? General fertility rate kya hota hai? What is the formula for general fertility rate? Anybody? It is number of live births, okay, per 1,000 women in reproductive age group. Is it all right? per 1000 women in reproductive age group. So this is number of live births per 1000 women in reproductive age group. Now, when we study fertility indicators, okay, what do we have here? There are some of the fertility indicators that you have to know. The first one is crude birth rate. Crude birth rate is the simplest measure of fertility. Why is it the simplest measure of fertility? What is crude birth rate? Crude birth rate stands for number of births per 1000 population, per 1000 mid-year population. This is simplest measure. Now, all those who are in the denominator, everybody is not exposed to childbearing. So, this is like the simplest measure, a crude measure. Next important one is TFR. What does TFR stand for, guys? Anybody in the comment section? TFR is total fertility rate. What is total fertility rate? Total fertility rate is an indicator of the number of children a reproductive couple is going to have. This is an indicator of complete family size. Okay, TFR is not the answer here, as most of you marked it. TFR is an option A is not the correct answer here. Completed family size is indicated by total fertility rate. Okay. Then the next option is that you have to know is gross reproduction rate. What is gross reproduction rate? It is the number of girl childs a reproductive couple is going to have. Okay. The number of girl child. And what is net reproductive rate? The number of girl childs who remain alive, or the number of girl child a reproductive age couple is going to have, considering what? Considering the current mortality pattern. Am I clear, everyone? So all these definitions are important to you. So the correct answer over here is, it is simply a measure of fertility. General fertility rate is obviously better than crude birth rate, because in the denominator we have reproductive age group females only. Okay. It is not an indicator of complete family size, because that TFR is. Am I clear, everybody? Give me a thumbs up. Is it clear? Somebody is asking, ma'am, current value of gross reproduction rate is 1.1. Now, what is this 1.1 that the person has written? Actually, what we are saying is total fertility rate. The current value is 2.2 and we want to achieve it to 2.1. Okay, this is possible only when my net reproduction rate is equal to 1. Okay, or gross reproduction rate is equal to 1, and this is possible when my contraceptive prevalence rate is more than 60%. Is it clear? Okay, let's go to the next question now. Yes, somebody has asked, TFR is equal to gross reproduction rate divided by 2. No, gross reproduction rate or net reproduction rate, this is equal to TFR divided by 2. Why? Because TFR is the total number of children. Now, gross reproduction rate is number of girl child. So, number of girl child, whether you consider current mortality or not, it should be half of total fertility rate. Okay, understood? Let's go to the next question now. Okay, the next question is, am I audible? Hello, everybody? Hello? Okay, the next question is, Panchayat Raj. Yes, I think now we are back. All right. Panchayat Raj at village level comprises of all except Nyay Panchayat, Panchayat Samiti, Gram Panchayat or Gram Sabha. So let me see your answers to this. This is an important question. What is Panchayati Raj, guys? Panchayati Raj is a 3-tier rural local self-government. Okay, rural local self-government, okay, linked to the district level. Okay, this is what is Panchayati Raj. Now, one question, look over here. This is the logo of Panchayati Raj. So, please keep in mind this logo also of PRI. Panchayati Raj institutions are rural local self-governments which are linked to the district level. Okay, now this is at 3 levels. This is also present at district level. Okay, this is also present at block level. Okay, and this is also present at village level. So at district level, this is known as Jila Parishad. Okay, this is important. At district level, it is Jila Parishad. At block level, it is Panchayat Samiti. Okay, and at village level, what it is? At village level, it is Gram Panchayat, okay, as well as Gram Sabha, okay, and Nyay Panchayat. So this you should keep in mind. Gram Panchayat, Gram Sabha, as well as Nyay Panchayat. So Panchayat Raj at village level comprises of all except the correct answer to this is B. Most of you gave an answer of D over here. The correct answer to this is option B, because Panchayat Samiti is something which is at the block level. Am I clear, everybody? Give me a thumbs up if you've understood this. Let's go to the next question for the day. The next question for the day is, remember this logo also. Yes, what is the WHO definition of blindness? Now this has also come in your examination. Yes, come on, mark your answers. Let me see your answers. So the option A is visual acuity less than 6/60 in better eye with best possible correction. Or is it visual acuity less than 3/60 in better eye with best possible correction? Or visual acuity less than 3/60 with correction in affected eye? Or visual acuity less than 6/60 with better correction in affected eye? So let me see your answers. Okay, so most of you are writing option B. Priyanka has written, John has written, Shrishti has written. Good. So according to WHO definition of blindness, what is the definition? Visual acuity less than 3/60 in better eye with best possible correction. One bonus question for all of you. Is the definition given by National Program for Control of Blindness and Visual Impairment the same as WHO? Is the definition given by National Program for Control of Blindness and Visual Impairment? The definition of blindness, is it the same? Yes. The definition by WHO and National Program for Control of Blindness and Visual Impairment is the same. According to your National Health Program, also the definition is visual acuity less than 3/60 in better eye with best possible correction. Okay, very good, everybody. Let's go to the next question. Yes, all I want you to tell me is mark the statements as true or false. A lot of questions, guys, come from the chapter of healthcare delivery system, which is a very, very important chapter. So the first question over here is provision of total beds at community health center is 30. So start putting your answers. Provision of total beds at community health center is 30. I'm asking you, provision of total beds at community health center. So is option A true or false? This is absolutely true. Okay, total beds at community health center is 30. What about the total beds at a primary health center, guys? What about the total beds at a primary health center? How many should be the total beds of a primary health center? It is 4 to 6 beds. Okay. Next question. One CHC covers a population of 30,000 in hilly areas. Is it true or is it false? Come on, start putting your answers. I can see some of the answers. One CHC covers a population of, okay, somebody is writing, all right, beds we've already done. Good. So one CHC covers a population of 30,000 in hilly areas. So somebody has, is it true or is it false? Vignesh is writing false. Sanjeev is writing true. Some of you are writing true. Okay, now one CHC covers a population of 30,000 in hilly areas is absolutely false. One CHC covers a population of 30,000 in plains. Okay, and what about hilly areas? In hilly areas, it is 20,000. Am I clear, everybody? One CHC covers a population of 30,000 in plains, but in hilly areas, it is 20,000. Next, lady health visitor is placed at a sub-center. Is it true or is it false? Quickly tell me. Lady health visitor is placed at a sub-center. Now, who is a lady health visitor? Anybody who is a lady health visitor? Can you tell me? Who is the, okay, I can see some answers. Aquil is writing true. Some of you are writing false. So who is a LHV? And LHV is nobody else but a female health assistant, okay? Or LHV is a health assistant, okay? Health assistant female. She is placed at where? She is placed at not a sub-center, but where is she placed? Anybody? She is placed at a PHC. Is it clear, everybody? So she is placed at a PHC, is a lady health visitor or a female health assistant. So this answer was absolutely false. Is it clear? Very good. Next option. PHC with more than equal to 10 deliveries per month is categorized as a type B PHC. Is it true or is it false? Female health assistant Vignesh is a lady health visitor. She is placed at a PHC. Next option is PHC with more than equal to 10 deliveries per month is categorized as type B PHC. No, Pawan, this is absolutely false. When we talk about PHC, PHC is of two types, either type A or it is type B. Alright, what is type A PHC? Very good, everybody. Type A PHC is where the delivery is less than, number of deliveries happening is less than 20 deliveries per month. Type B PHC is where the number of deliveries is more than equal to 20 deliveries per month. Is it clear, everybody? So that is a type B PHC. Am I clear? So this answer was absolutely false. So you've done a lot of questions for healthcare delivery system today. Okay, let us proceed to the next question for the day now. All right, this is beautiful question that was given in your FMG examination only. The question is, separation of healthy individuals and animals exposed to communicable disease for a period of time not longer than the longest incubation period of the disease is. Can you tell me the answer over here? Is it isolation? Is it absolute quarantine? Is it modified quarantine? Or is it interruption of transmission? So I can see some of the answers over here. So people are writing B. Good. All right, good, everybody. So this is exactly I've taken from your August FMGE. Separation of healthy individuals and animals for a period of time not longer than the longest incubation period is absolute quarantine. Okay, now what is modified quarantine, guys? Modified quarantine is partial limitation of movement. Is it clear? Modified quarantine is partial limitation of movement. Is it clear? All right, so we should know what is partial limitation of movement called as. That is called as modified quarantine. Okay, let's go to the next question. Very good. Okay, one bonus question for all of you. Isolation is which level of prevention? Isolation is which level of prevention? Can you tell me? Isolation is which level of prevention and quarantine is which level of prevention? Quickly tell me. Isolation is, very good. Isolation, everybody, is secondary level of prevention. Why? You are isolating. Whom do you isolate? The cases. Okay, so it becomes a mode of treatment. So isolation is secondary level. Quarantine is what? Quarantine is primary level of prevention. Is it clear? Okay, whom do you quarantine? Very good. You quarantine the healthy contacts. Okay, so quarantine becomes a primary level of prevention. All right, very good, everyone. Let's go to the next question. Okay, all of the following come under primary prevention except, so is it pap smear, helmets, wearing of helmets, contraception or vaccines? This is again an FMG question. All of the following come under primary prevention except. Can you tell me? Pap smear, helmets, contraception or vaccines? Let's see your answers. What is the answer, everybody, to this question? So when we look at the options, why do you wear helmets? What is primary level of prevention? Primary level of prevention kya hota hai? It simply means that risk factor is present. Okay, risk factor is present All right, but what has happened? Risk factor is present, but disease has not started. Okay, disease has not started. So that is what is primary level of prevention. Primordial is the risk factor is also not present. So over here, why do you wear helmets in the street? Because risk factor is present. People can drink and drive. Okay, there might be a broken road, so you need to wear helmet. So helmet is a primary level of prevention. Contraception is a primary level of prevention. Okay, vaccines is a primary level of prevention. It is specific protection. So what did your FMG question say? It said all of the following come under primary prevention except, so the correct answer is pap smear. Why? Pap smear is a mode of screening to make an early diagnosis and intervention. So this becomes secondary level of prevention. Am I clear, everybody? Okay. So did you understand the question? Very good. So this is previous year FMG only. So let's proceed to the next question of the day. Yes. Again, I want all of you to mark true and false to the following statements regarding vaccination. Vaccination is a very important chapter in FMG. Okay, the first question is, storage of vaccines can be done at district level up to 1 month. Good, Neha. All right. So next question is, storage of vaccines can be done at district level up to 1 month. Let me see how many of you marked this answer correct. Okay, so Vignesh is writing is that it as true. Let's see some of the other answers. Now, everybody, please remember that when you talk about, this is the question regarding cold chain. Okay, what is the cold chain temperature in India for maintenance of vaccines? It is +2 to +8 degrees C. All right, everybody knows. Now, at district level, you can store it up to 1 month only. Okay, suppose here let's draw a line. Below this we have sub-center and villages. Can we store the vaccine at sub-center and villages? No, we carry out our sessions at sub-center and villages by means of vaccine carriers and day carriers, okay, which can maintain your vaccine for duration up to 24 to 48 hours. At PHC, you can store the vaccine in small ILR, and you can also store the ice packs in small deep freezers. Okay, then at CHC or at district levels, okay, you can store it in what? At district level, you can store it in large ILRs and large deep freezers. Okay, and last but not the least is center or state or regional level. Am I clear? So center or state at regional level में आप किस में स्टोर करते हो? Walk in cold rooms vaccine and walk in freezers में ice packs. Okay, so up to district level, whether it's PHC or district level, you can store it up to 1 month. But what about the center or state level? You can store it up to how long, guys? You can store it up to 3 months. Is it clear, everybody? Okay, give me a thumbs up if this is clear to everybody. Very good. Walk in cold rooms. So the option A, storage of vaccines can be done at district level up to 1 month, is absolutely true. Next question. Most important component of cold chain in India is ice-lined refrigerator. What have you written for this? Most important component of cold chain in India is it ice-lined refrigerator? Yes, it is absolutely true. Okay. Then temperature monitoring of ILR is done once using a dial thermometer. So in an ILR, we have an instrument, a dial thermometer, which is placed for monitoring of temperature. So is it done once daily? This option is absolutely false. Okay, temperature monitoring usually is done by an ILR not once daily, but we do it twice daily. Okay, very good, everybody. So you're marking the correct answers. Next, maximum chance of failure of cold chain in India occurs at PHC level. Is it true or is it false? Maximum chance of failure of cold chain in India occurs at PHC level. No, it is false. Maximum chance of failures occur at which level, guys? At sub-center and village level. Is it clear? Why? Because there you do not have instruments to store. All right, you just conduct your sessions in, say, vaccine carriers or day carriers. So maximum chance of failure of cold chain in India occurs at PHC level. Okay, sorry, at sub-center or village level. Last, the vaccines are transported in red color vaccine carrier in cold chain. Can you tell me, is this true or is it false? Are the vaccines transported in red color vaccine carriers in cold chain? Very good, Vignesh, Sanjeev. This is absolutely false. Vaccines are transported in which color vaccine carriers? Either it's blue or it's white. Now, one bonus question for all of you. What is transported in red color vaccine carrier? What do you transport in red color vaccine carrier? Anybody? What is transported in red color vaccine carrier? What do you transport? Very good. In red color, it's not a vaccine carrier, red color carrier. You transport stool samples, okay, because which you collect for AFP surveillance. Why? Because the temperature required to store stool samples is +2 to +8 degrees C. All right, okay, very good everyone. Let's go to the next question for the day. This is just an image. This is an ILR, most important component of a cold chain, and over here you have a dial thermometer. Dial thermometer is based on the principle of, one additional question, dial thermometer is based on the principle of conduction, convention, thermocouple. So this is based on the principle of thermocouple, and you have to monitor the temperature twice on a dial thermometer. Okay, all right, good. Let's go to the next question. The last question for the day is 90-90-90 target is directed towards which disease? Not the last question, we have two more questions. 90-90-90 target is directed for which disease, guys? This is directed for, I can see some of the mixed answers here. Some are marking A, B. 90-90-90 target is for HIV AIDS. Look over here, guys. What is 90? 90% of all people living with HIV should know their HIV status. 90% of all living with HIV will receive antiretroviral therapy, and 90% of all receiving the antiretroviral therapy should be undergoing or should be having viral suppression. Okay, so this is very important. Okay, but this 90-90-90 initiative was given by whom? Anybody? 90-90-90 initiative was actually given by UNAIDS. Okay, this 90-90-90 initiative is to be achieved by 2020, and now we have similar thing, 95-95-95 initiative given by UNAIDS. This is to be achieved by 2025. Is it clear, everybody? Sorry, 2024. Okay, it's the same thing. 95% of all living with HIV should know their HIV status. 95% of all knowing their HIV status should receive antiretroviral therapy, and 95% of all receiving antiretroviral therapy should undergo an adequate viral suppression. Is it clear? Let's go to the last question of the day. Yes, an easy one. Number of visits to be made by ASHA under home-based newborn care. All right, newborn care program in institutional deliveries. So in case of institutional deliveries, I have taught you for TB. TB, somebody is asking what is the initiatives for TB. Guys, I've already taught you this. Initiatives for TB, एक तो होता है according to end TB, okay, according to which we are trying to eliminate TB by 2035. So according to end TB, it is 95, 90 and 0. 95 reduction in death rate, 90% detection of incident cases at least, and 0 poverty. Okay, the other one is that your program has launched is 90-85. Okay, so that is the thing that has been done by a program. Is it clear, everybody? Now tell me an answer to this, everyone. Number of visits to be made by ASHA in their home-based newborn care in institutional deliveries is, so in institutional deliveries it is number of visits to be made is, very good, I can see some of the answers, it is 6. Okay, what? And in cases of home delivery, what is the number of visits to be made? In cases of home delivery, the number of visits to be made is 7. So what are the days in case of institutional delivery that you have to make a visit? So in case of institutional delivery, can anybody tell me? 3, 7, 14, 21, 28 and 42. This is in case of institutional delivery, okay? But in cases of home delivery, it is 1, 3, 7, 14, 21, 28 and 42. Very good. So this becomes equal to how much? 1, 2, 3, 4, 5, 6, 7. Okay, but one bonus question, everybody. In case we say that a woman has undergone lower segment LSCS, then what is the number of institutional deliveries, a number of home-based, number of visits to be made by Asha in case of women who have undergone an LSCS? Anybody? No. Very good. Azhar has given the right answer. Very good, Azhar has written 5. ठीक है, in that case it is 5. क्यों? क्योंकि third and seventh, the lady gets discharged on the 7th day only. All right, so therefore you will not be making a visit, the Asha will not be making a visit on the 1st or the 3rd day. She will be making a visit on 7th day, 14, 21, 28 and 42. Am I clear, everybody? Now, before we end the session, I want to give you one more image and one. Tell me, what is this? Image represents larva of which mosquito? So this is an image which is representing the larva of which mosquito? Can you tell me? This image represents the larva of which mosquito? So good. I can see some of the answers over here. This represents the larva of. Good. So you are writing as C. Very good. This is Anopheles. Why is it Anopheles, guys? Because Anopheles does not have any siphon tube. Look over here. This is Culex and Aedes. Both of them have a siphon tube, and by the help of this siphon tube, they get attached to the surface. Is it clear? So this is very important. Last time I had shown you the images of adult mosquitoes, Anopheles, Culex, all these things. Today I have shown you about the larva. Okay. All right. Last question. This is the numerical which most of you get confused in. So try to do it. The incidence of carcinoma cervix in women with multiple sexual partners is 5 times the incidence seen in those with a single partner. Based on this, what is the attributable risk? So come on, let us see how many of you are able to mark this answer correct. Now, what is the formula for attributable risk, guys? Quickly mark this answer. So attributable risk का formula क्या होता है? It is incidence among exposed minus incidence among non-exposed divided by incidence among exposed into 100. All right. Yes, Jay, I am also conducting these. You've said you want 2 or more sessions before exam just like this. Definitely, I'll be having 2 more sessions on YouTube. But at the same time, Jay, I am always conducting special classes. We are having FMG Marathons Day on the Unacademy app in the mornings, usually at 9 a.m. Again, we have another session on Thursday. Okay, on Thursday we have another session from 9 to 10:30 a.m. Okay, it's a free class. It's a special free class on previous year's FMG marathon. Okay, so you can attend that, all of you. Just download the Unacademy app and you can go to my profile and attend the classes. Is it clear? Okay, we have already had 3 to 4 marathons for FMG. I usually conduct them in the morning at 9 a.m. So right now we are having previous year questions FMG marathon only. Okay, so I have also shared the link on my Telegram channel. You can join it. Sure, I am also planning to do an image-based session maybe on the 29th or the 30th. Okay, so you can attend those image-based sessions. Whatever sessions we are having, the time for my community medicine, the free sessions are 9 to 10 a.m. in the morning or 8:30 to 10 a.m. in the morning. Is it clear? So I accordingly schedule the classes and put it out on Unacademy Telegram group also. So you're most welcome to join. Do join on Thursday, everybody. FMG Marathon. We discuss almost 40 to 45 MCQs. Okay. So now the answer over here is yes. What was the question? Yes. Now suppose those who have single sexual partner, there the incidence of cervical cancer is X. So those who have multiple sexual partners, okay, so non-exposed jo hai, that is X. Okay, those who have multiple sexual partners, that means those who are exposed, it is 5x. So all that you have to do is 5x minus x upon 5x into 100. Okay, so this comes to be what? 4x by 5x into 100. Is it clear? So isko, if you calculate it, it comes out to be 80%. Guys, please remember, whenever you have to solve these numericals, first think about the definition. Then think about, do you need to draw any 2 by 2 table as such? Okay, then accordingly you write your answers, like you draw the table. Here you did not need the table, you could have done it like this only. So is the questions clear to all of you for the day, everybody? Okay, so all I would like to say is that although FMG is coming on 4th of December, don't worry, don't stress yourself too much. Okay, believe in yourself, trust your preparation. You have studied it, you are studying it, nobody knows more than you. All right, thank you so much, Akshay. Yes, it's my daughter's birthday tomorrow. All right, and so again, I will be holding an FMG marathon on Thursday, 8:30 to 10 a.m. or 9 to 10:30 a.m. I will be sharing the link very soon on Unacademy Telegram group, also on my own Telegram group. Also, you can check the link on my Unacademy profile. Okay, you can go check the link, so that is there. Also, we have one more thing I wanted to tell you is that don't worry at all. Just keep studying, be consistent, and abhi kya karna hai guys? Revision. ठीक है, revision is the key now. Keep revising and keep practicing MCQs. ठीक है, don't just read your notes. Keep practicing MCQs, keep revising. That will get you to your point. Previous year's papers, sub subject mein, try to, have a look at it. Okay, last 5 years at least, and see all the repeated topics and revise it. Okay, keep revising. All right, thank you so much, Priya, means a lot. I am so happy that you are enjoying PSM, and I am very happy and I'm very thankful to Unacademy for giving me this platform, to reach out to so many of you students. So keep attending my PSM classes. Tomorrow at 11 a.m. I have a YouTube session that is on एम्स में जो अभी क्वेश्चन आए थे, एम्स PSM recall. Okay, so if anybody wants to attend, you can attend tomorrow at 11 a.m. and yes, that's all for today. And be safe, be protected, keep studying, keep revising. From my own personal experience, I'm telling you, just keep revising, you will get through it. Okay, all the very best, take care, and hope to see you all again on Thursday at 9 a.m. on Unacademy app for the free live class. Okay, for any subscription of Unacademy, you can use my code Dr. Neha 10 or PSM 10 and get a 10% off. All right, okay, take care. Yes, Neha, it's for INI CET कल sorry मैंने AIMS लिख दिया. INI CET PSM recall tomorrow at 11 a.m. Okay, thank you so much, everybody. Good night and take